Hey, we've looked at thousands of Medicare beneficiaries plans this year. Going into this upcoming year, I'm going to explain to you exactly why this specific plan has been the number one choice for most seniors going into the new coming year. Stick around, I'll be back in just a second. So what exactly is going on with Medicare First to get to what plan most seniors are choosing? I'm going to explain to you exactly the 4 or 5 different moving parts of what's happening in Medicare, explain exactly the details of those, and then walk you through exactly what plan is going to be the best fit for most seniors going into this new year. This is by far one of the most craziest times we've ever seen in Medicare. I've been in the business for 17 years. It's never been a time when really all the perfect storm has happened. And that storm obviously is affecting you, it's affecting our industry as far as independent insurance agents and agencies like us that serve a Medicare population. I'm going to walk you through what's happening. One of the big issues that Medicare has had higher servicing use post-pandemic. So during the pandemic, a lot of people were not going to the doctor. Post-pandemic, all of a sudden, all the hip surgeries, the knee replacements, and everything that people could not access or did not want to access during that time period of 2019, 2020, 2022, and even 2023, we saw people just waiting to get surgeries. And then all of a sudden in 2023, all the way up to the current time, we've seen a lot of people go in now to get those major surgeries or are not afraid of going to the doctor or going to the hospital. So that's created a huge kind of medical loss ratios that now have adjusted based on the Inflation Reduction Act. You have healthcare plans now over the last 2 years that have had to take on more and more cost to subsidize the cost for medications that are Medicare approved. So that's a second thing that's happened. The post-pandemic wave has created new rules and payment models. So a lot of what we're seeing right now is based on the PPO health plans that are leaving and exiting markets. I'm going to explain that a little bit more in detail. But those are really the main things. And then in the reshaping of benefits, we've seen networks with doctors and hospitals come in and out of network with Medicare Advantage plans. And this year, we have a lot of Medicare Advantage plans just being taken off the market, which leaves you exposed to either A, choosing another Medicare Advantage plan, or it also gives you the opportunity to enroll into a guaranteed issue Medicare supplement. If you haven't watched one of our videos, I'll tag that video below in this video so you can watch that video as well, explaining exactly what eligibility options you have based on when you lose coverage with a Medicare Advantage or prescription drug plan. It opens up special election time period where you can actually enroll into a guaranteed issue Medicare supplement. So let's dive into the 4 major changes that are occurring right now in much detail. So I'm going to walk you through the 4 major moving changes and parts of what's happened over the last 5 years. I'm going to read some notes to you and then I'm going to explain each of these points as I go through them. But what's caused all the disruption with Medicare and affecting the MA market, especially PPO plans. So if you're on a Medicare Advantage PPO plan in 2024, 2025, going into 2026, you probably have seen some crazy things happen with your plan. One, the cost pay or co-pays have probably gone up. They've degraded benefits. And in a lot of markets, we're seeing in markets where 100,000 people are losing their coverage that are on PPO plans. Certain high-risk states across the union right now are experiencing catastrophic loss in coverage. So last year, what was projected to be 1.2 million people ended up being about 1.4 million people that lost either A, their Medicare Advantage plan or their prescription drug plan. So I've said this before, but there used to be 35 prescription drug plan carriers. Now there's only 7. They're offering about 2 plans per carrier. So you have 14 plans where before there was 35 carriers with multiple plan options. That has been degraded back and brought down. One of the reasons why is they just couldn't keep up with providing the coverage based on the new regulation and rules and the cost sharing. Therefore, certain carriers have just pulled out of the prescription drug plan market. Well, that applies to the prescription or Medicare Advantage PPO plans as well. Because medical loss ratios typically are higher on PPO plans, there's not regulation for certain things that happen in HMO plans. PPO plans have become at risk, and some carriers who have done well with their HMO product, Medicare Advantage plan, have not done well with the PPO, and therefore they're pulling out of those markets trying to recoup. And some of that is reflected by the reimbursement rates based on star ratings that have occurred with Medicare over the last several years. The higher the star rating with the plan, the more money that's reciprocated from Medicare to that health plan. So when you have a PPO plan that's rated over 2, 3, 4 years at a 3-star, and they have a that same carrier has a HMO product that's had 4 or 4.5 stars, that 4.5 stars means they have been given more money, which allocates back towards your benefits. The health plans can't profit but a certain percentage based on Medicare regulation. Everything else has to go back towards the benefits. So I have always said this, and if explained properly, if you go back and watch any of our videos talking about Medicare Advantage and how HMOs and PPO plans work, HMO plans historically have been more stable plans, especially in metro areas. If you're on a HMO model plan, though, even though PPO plans are being taken off the market, we are seeing now HMO plans that have not performed well being taken off the market. So my suggestion would be, if you do not, before I get into the second point, if you do not have an agency that can walk you through a proper Medicare review, you can schedule a time by clicking below. We'd love to be able to talk to you. We can look at your plan, whatever area in the states that you're in, and see what plans are available. And then if your plan's being taken off, you should have received something in the mail from your carrier letting you know that that plan is being extracted or replaced. Or there's also what they call crosswalk, which is where they're taking one plan, doing away with that plan, but crosswalking you into another plan. Now, a few years ago, crosswalking health plans would actually help the agents or agencies like us by taking someone from a PPO to a different PPO, because they brought that PPO out of a performing market where it had a high rating and the stars were higher and they were getting reimbursed more, and they would bring it into the current market and replace and do a crosswalk. Well, that has kind of changed as well. So my encouragement is, get with someone that's licensed, professional, and knows what they're doing to walk you through a proper review. If you don't have someone, I would encourage you guys to be able to reach out, call us. We'd love to be able to talk. And then I'm going to go into the second part about the Medicare adjustments that are affecting a lot of things, and then pointing towards what plan is best going into the first of the year. So let's talk about the Medicare adjustments. It's the Medicare MA Risk Adjustment Model Update, which is CMS-HCC version 28, phased 24 through 26. So this new model phasing has tightened payments for some conditions, driving benefit trims or trimming of benefits, higher max out-of-pockets in some markets, and narrow networks in certain markets. So what has happened is, when there's loss or like there's bleeding occurring, they're trying to stop the bleeding of these healthcare plans. They created legislation, and within that legislation, some of the carriers are walking outside of that legislation boundary, and they were losing reimbursement rates, which again is what I was talking about earlier, and just falls underneath this billing. So what happens in that? One, Medicare is just kind of doing just a whole new kind of upturning and changing legislation. The Inflation Reduction Act has occurred. The big beautiful bills occurred. Also, you see the pandemic, the post-pandemic surge of people getting surgeries. And so when that happens, usually there's legislation. As I like to say, you can't really legislate morality. People doing right and wrong is not created from laws and restrictions, but in our government with our healthcare coverage, sadly, a lot of times what they'll do is create new legislation to try to push the agenda of the healthcare companies to do better when it comes to, risk management and all types of different stuff. And on top of that, typically that doesn't work. A healthcare company has to engage with the model where it's customer centric. And if they've ballooned their enrollments up and had huge amounts of enrollments in new markets over 2 or 3 years, then a lot of times they don't keep up with that, with having proper customer service, appeals processes in place. Fraud, waste, and abuse occurs from the doctors a lot of times, from the health plans. I mean, there's all this combination, and the perfect storm again is created, and that's what we've seen over the last 2 years. So if you are feeling the weight of like, oh my gosh, this is so confusing, what am I supposed to do? And you're hearing all this rhetoric come at you, there's a couple of things you need to be aware of. One, you need to just be aware of false advertisements that's coming at you, because a lot of times in desperate times when there's fear, there's a lot of people throwing even a sense of greater fear out there by using advertisements, marketing strategies, phone calls, text, and they're wanting to create this panic in you that you have to make a decision based on, in a sense, emotion as opposed to logic. So my encouragement, again, coming back to the importance of having a relationship with an independent agency that has an agnostic approach. If you don't have that, you need to have that, because guiding you through the new legislation, how does this affect you? Not all the rules and changes affect you. Some of the rules and changes are going to affect you. And then some of you, thousands of you that'll watch this video, will end up losing their Medicare health plan or Medicare Advantage plan and going into the first of the year. And if you have not paid attention to some of the documentation coming from your health plan and you lose your coverage and you go into the first quarter, the first time you go to the doctor and pull out your old card and they say that plan's not active anymore, there's going to be a huge sense of fear. So making sure you work with the right professional to guide you through this process, and then moving forward into the future as new legislation is passed, you being made aware of that and educated on that, making sure that you're on the right plan is so key. We're going to go into the step 3, which is a star rating and how that's impacting a lot of movement and change this year. How does this star rating? For years, I've always said star ratings don't really matter that much because most plans had either a 3.5 to 5 star. There's new legislation I'm not going to dive into today that's kind of adjusted some of that. But star ratings, how does that affect your coverage and your benefit when it comes to a Medicare Advantage plan? Or if you're looking at a Medicare Advantage plan, should you base your decision on star rating? My thing with that would be always base your Medicare Advantage option choices on these key things that I always say and communicate first. One is your doctor and specialist and medication in the plan. Do you live in a metro area or centralized around a metro area within a 60-mile or maybe a 30-minute trip into a metro area with a heavy population of a medical community? So I live right outside of the Nashville market. We have a huge metro area of physicians, specialists, hospitals, access to care. If you're in a rural area and you're looking at, I have a Medicare Advantage plan and I've never really been able to find a lot of doctors. And if your plan's being extracted, because in rural areas right now, the Medicare Advantage plans are not performing well. So if you have a PPO plan, you're losing that. I'm going to talk about exactly what you can do, but you have a guaranteed issue to go into a Medicare supplement. We'll go into that just a little bit later and exactly the steps to take and why that may be a better option for you. But the star rating recalibration and bonus volatility from 2024 until 2026, basically since the post-pandemic adjustment lowered many plan star ratings in 2024 and 2025, it shrank the quality, what they call quality matrix bonus that's paid back to the Medicare health plan. So how is that affecting you? If you're on a Medicare Advantage plan, it's probably you're going to see a degradation in your dental, hearing, vision, over-the-counter benefits, all the advertisements you see all the time about free food or a free food card. That's really being re-regulated by, if you have a chronic condition, you qualify to be able to enroll into certain plans that may have a food allowance. Otherwise, if you do not have a really a special need or a chronic need, you're probably not going to qualify for any plan that has a food allowance. So if you see something online, you see a Facebook ad and it's talking about, $3,000 food allowance or $300 a month food allowance, if you're not chronically ill or have a chronic disease that falls within the 4 categories of chronic diseases, you're probably not going to qualify. So if you get on the phone with somebody, they're not going to enroll you into that. They're going to try to sell you into churning you into a different Medicare Advantage plan. So be aware of that. But the star rating recalibration, what it did was it reduced the cost because based on the star ratings, if it was a lower star performing plan, they paid less money. And then what we saw was carriers, because they didn't want to lose enrollments, continue to push money towards their additional benefits like dental, hearing, vision, and things like that. And some of them would raise the copay cost some. And because of the new legislation and regulation around prescription drug plans, now plans are having to align their copay cost, also their formulary and their prescription drug costs. And because of the reduction of pay, you're going to see degradation of dental, hearing, vision, over-the-counter benefits, what I call bells and whistles on plans. Now, our approach is always to determine what plan, if you're going into a Medicare Advantage plan, what has your doctors, your specialists, your medications. That's the main coverage. And then the secondary thing is, hey, it does have dental, hearing, and vision. It's great if you have a lot of dental, hearing, and vision, but if it doesn't cover your basic needs of access to care, the plan is not a good fit for most seniors. Most people, when you're talking to them over the phone through a call center, they're selling you on features and benefits, dental, hearing, vision, over the counter. Oh, this really it has 2,000. Your plan only has 1,000 of dental. But if they're not reviewing and going over your doctor's, specialists, and medications, they're doing an injustice to you. And then when you show up with your new plan at the first of the year, you're screwed and you can't see the doctor of your choice. And it puts you into a dilemma of not getting the quality of care that you want. Now, going into this fourth thing, we're going to talk about the PDP market adjustment and consolidation that's happening this year and going into the next year as well. Guys, if you have any additional questions, reach out to us. We'd love to have the opportunity to help guide you, answer any questions that this video may have posed or any of the things that you've watched. And guys, before you go, make sure you subscribe, like, and hit the notification. It's a great way to keep up with everything that we're putting out as far as content. Share it with a friend. This is a huge, big year for Medicare. A lot of changes going on, a lot of confusion. The last few videos and the next few videos that we're going to be sharing are going to be about what's going on with changes and all the things that are impacting millions of seniors around the U.S. Share it with a friend. We'd love to be able to see them jump on a video as well. Until next time, we'll see you on the other side.